part of that disc is actually pushing out into either the spinal cord or the foramen where the nerves come out. Pushing out somewhere. Hey, it's Dr. DeCubellis. I want to talk real quick about herniations. Now, herniations are something that can happen from a lot of different issues, whether it be a fall, whether it be a car accident, whether it be overuse. We've seen herniations happen from that. Now, the biggest thing is that all herniations are not the same. So there's a couple things that we have to look at. With a herniation, when it's a herniated disc, that means that part of that disc is actually pushing out into either the spinal cord or the foramen where the nerves come out. It's pushing out somewhere. When that happens, that disc is now occupying space that it should not be. So there's less space for the stuff that should be there, right? And that's why it causes problems. But how much of that disc is put out is what's really important, and in what direction. Because if it's going out straight back, then we have to worry about the spinal cord. If it's going out to the sides, then we have to worry about the spinal nerves. This is why it's so important to look at what the symptoms are. Are you having pain that radiates, or are you having pain that's in one centralized area? But it's important to understand too, if we have a herniation that's going and putting pressure straight back on a spinal cord, we can have problems not only in that area, but anywhere below that area potentially as well. So we have to look for all these things. MRIs are great to be able to tell what's going on and where that herniation is, but with those as well, it's just one piece of the puzzle. The MRIs are very helpful in saying that we have a herniation, but then how we treat it depends on how severe it is and the symptoms too. So it's really important to make sure that when we have a herniation, we're looking at evaluating it not only from how severe it is on the imaging, but also what symptoms the person has. This tells us whether it's something that can be worked on with rehab, like chiropractic or physical therapy, or it's something that's going to potentially need surgery and need to go to an orthopedic or a neurosurgeon. So this is why I work with lots of different doctors, because there's not one size fits all for everyone. But we want to make sure we're getting the right kind of diagnosis first, checking all those boxes and doing what's right for the patient. So herniations have various different ways they can affect you and can come in many different forms. So we have to make sure we're looking at all of these things and evaluating you properly.